In this video, we are going to talk about pressure sores, their various stages, and why you might be more at risk for developing a pressure sore. We will have another video covering how we work to prevent pressure sores and also how we conduct what we call skin checks. Be sure to view that video to cover that material as well. The learning objectives are listed above, so like I said, we'll define a pressure sore, we'll talk about the importance of pressure relief, we'll go through the stages of a sore, and we'll also discuss risk factors. To start out, pressure injuries, also called pressure sores or ulcers, can occur when you're sitting in a bed or a chair for a long period of time and you're not changing positions on a regular basis. When you rarely move, your body weight limits the blood flow to your arms, legs, neck, and back. The lack of blood flow to the skin and tissues under the skin may cause them to break down until a sore appears. Pressure relief is important for many reasons. Pressure ulcers following a spinal cord injury represent a challenging problem for patients, their caregivers, and their medical team. They often lead to recurrent hospitalizations, surgical interventions, delay of necessary rehabilitation, and other potentially devastating complications. These can be extremely Pressure relief is important for many reasons. Pressure ulcers following a spinal cord injury represent a challenging problem for patients, their caregivers, and their medical team. They often lead to recurrent hospitalizations, surgical interventions, delay of necessary rehabilitation, and other potentially devastating complications. These can be extremely uncomfortable, painful. We want to keep in mind how severe these can become and do everything that we can to prevent it. 95% of pressure sores are actually preventable. Pictured above is a representation of how deep pressure sores can go down into the body. So you can see on the side here that what's being depicted is your layer of skin on the outside being that topmost layer right up here. And as we move down, we move to the fat layer, muscle, and eventually bone. As you can see in stage 1, the skin is red, maybe painful, but the skin's not broken. In stage 2, the skin is broken or may form a small hole as shown above, or it may even have fluid-filled blisters. As we enter stage 3, this is when that pressure sore goes down into the fatty layer as well. In stage 4, the damage from the sore reaches all the way down through the skin, fat, muscle, and to the bone. There are several reasons why you might be more at risk for developing a pressure sore. This can include not being able to move without help or having limited movement. You might have a loss of feeling or sensation that would prevent you from being able to feel pressure or soreness on your skin. If your skin is often wet or soiled, then this can also put you at risk, as well as if you stay in a bed or a chair for most of the time. Having poor blood flow or other severe illnesses, not eating well or eating foods that aren't providing enough nutrients, and then also if you're older and have more frail or thin skin, those are all also reasons why you might be more at risk for developing a pressure sore. Now that we've introduced you to pressure sores and what they are, please move on to the next video to learn about some ways to prevent them and how to conduct what we call a skin check.